Hello, my name is Tori Jackson, and I'm a student pharmacist. And I've noticed that you've been staying here for several minutes, and I was curious to see if there was anything I could help you with today.
Yeah, that'd be great.
Okay, I'd like to go ahead and take you to our consultation room to determine the product that will best fit your needs. It will take about 5 to 10 minutes. Is that okay with you?
Yep, that's fine.
All right, just follow me. Okay, now that we're actually in our consultation room, the first question I'd like to ask you is, are you seeking treatment for yourself today?
Yes, I'm actually just seeking treatment for only myself today.
Okay, what kind of symptoms are you experiencing?
Just flaking from my head.
Okay. Since you've started experiencing the symptoms, have there been any changes associated with your symptoms?
No, it's just been flaking some more, and it's been pretty embarrassing.
I apologize that you actually have to go through this. Hopefully we'll be able to treat you and get you back to your normal self again. Have you actually been experiencing any itching with your flaking?
No, just no itching at all.
Okay. Has this been a issue in the past, or have you ever used any kind of treatment to even treat this actual occurrence?
No, this is like the first time, so I haven't had to actually treat it in the past before.
Okay. When did your symptoms start?
About 3 days ago.
Okay. And I know that you said that you're experiencing flaking in your scalp. Are there any other areas that you're experiencing the flaking?
Actually, just only my scalp.
Okay, great. Have you noticed that anything makes it worse?
For the most part, combing it apparently makes more flakes show up than normal.
Okay, yeah, that's understandable. Is anything making it better?
Yeah, just leaving my head alone.
Okay. Are you currently taking any medications right now?
Nope, I'm as healthy as an ox. Don't need to take any medications
Awesome.
right now.
Great. And do you have any allergies? This would consist of food, medicine, environmental allergies?
Not that I'm aware of.
Okay, great. What about chronic illnesses like asthma or diabetes?
Nope, not yet. That's always a good thing.
Okay, great. Okay, so from your symptoms, I can see that you're experiencing dandruff. And I feel like the best medication to treat your symptoms is pyrithione zinc, which is the active ingredient in common products such as Head and Shoulders. This medication is intended for topical use and is used to relieve the itching, irritation, and flaking associated with dandruff. It is actually effective within the 0.3 to 2% dosage range. So when we actually go look for a product that best fits your needs, we're going to look at the label information and make sure that it's going to be effective for your treatment. This active ingredient is included in various types of products, with the shampoo formulation being the most common, which, again, like I said, Head and Shoulders, so that's what I'm going to end up recommending for you today. When you use this product, you will actually wet your hair and massage the product into your scalp. And you would actually leave that product on your scalp for 5 minutes prior to rinsing in order to provide you with dandruff relief. How do you think that you will best ensure that you actually leave your product on for the recommended 5 minutes?
I think I'm going to have to probably set like some sort of timer or something. Probably like start at like a 10-minute timer for the entire length of my shower for the whole 5 minutes. I think that'd probably be the best.
Yeah, that would actually be a great idea. Once the 5 minutes are up, you'll be able to rinse the product out and continue your regular shower routine. You can use this product once daily for a week. After that week, then 2 to 3 times a week for 2 to 3 weeks. After that initial 3 to 4 weeks, you'll be able to utilize it weekly or every other week to control your symptoms. I understand that this is a lot of information that I'm giving you, but I'm going to go ahead and write it down for you as we go, so that way you can take it home with you and utilize the information. But so far, do you understand how to utilize the product?
Yeah, I will be using it daily for a week, leaving off for about 5 minutes every time, and then I will be using it about 2 to 3 times a week for a few weeks.
Okay, yep, that is actually correct. And after that treatment span, you can actually use it weekly or every other week, as I noted before. I would also recommend that you would purchase a scalp scrubber along with the product to assist with the removal of the flaking throughout the process. You can use this product to assist in the leathering of the product and while rinsing your scalp to actually gently remove this flaking from your scalp. I'll actually show you some of the options that we have available with the scrubbers when we go to locate the product that's best for you.
Yeah, that'd be great.
Okay. You'll also be happy to know that there aren't any common or any rare adverse effects associated with this active ingredient. However, if you experience any signs of serious skin or scalp irritation, such as like a rash or hives, I would strongly suggest that you would contact your primary care physician. It is also important to note that this is for product is for external use only, and in the event that you actually get it in contact with your eyes, you're going to want to use cool water to rinse it out and to ensure that the product is removed from your eyes, which could take several minutes. Also, in the rare event that it's ingested, meaning you would get it in your mouth and swallow it, you would want to contact the Poison Control Center, which is typically noted on the bottle, like that it will give you the information for contact. So we'll ensure that it's listed. Do you have any questions so far?
Yes. Nope. It seems to be pretty safe treatment for me.
You're actually correct. The only thing that I would suggest is that you try to keep your mouth and eyes closed while lathering and rinsing out the product to avoid the ingestion and the exposure to your eye. Along with the absence of adverse effects with the drug, there aren't any drug-to-drug interactions that have been found to be associated with this drug. However, if you end up taking any new medications, I would suggest that you would note that with your primary care physician just to make sure. In the event that you actually miss a dose, you could actually go ahead and shower and put that product in, or you can just go ahead and continue on with the next dose. This product can actually be stored at room temperature, but I do suggest that you keep it out of reach of your pets or children. Do you have any children at your home?
Let me see. Yes, but I can place the product on the shelf in the shower that they can't actually reach, so I think that should be fine.
Okay, that's actually going to be a great location to put the product. While using this treatment, I do recommend that you watch for volume reduction of flaking and ensure that you are leaving the treatment on for the recommended 5 minutes. I also recommend the use of the scrubber as mentioned before. If you aren't experiencing any improvement within 2 weeks, I do suggest that you contact your primary care physician for further treatment. Do you have any questions about what I've went over so far?
Nope.
Okay. Well, now that we have determined the necessary products, let's go ahead and locate the products that you'll need to go ahead and purchase today to get you taken care of, okay?
Yeah, sounds good.
Awesome. Great.